We have two experts. We're so glad to have them with us today. Brock Kull from Manpower and Ben Weaver from Servpro, going to talk to us about how we can get our employees feeling comfortable with the transition as they come back to work, and also how we can prepare from a cleanliness and sanitation standpoint. So again, we're so thankful that both of you have agreed to speak with us today. Just want to mention before we turn it over to you, the Chamber is preparing our getting ready to go back to work packets, if you will. We have some signage for you that you can post in your businesses. We have a lot of the paperwork and resources that you may need and want to have easy access to. So we're putting those packets together. We're also including green ribbons. We're going to be doing a green ribbon campaign. So we're going, going forward, moving forward. And so more to come on that, but those packets will be available certainly before next Friday for you. So we'll send out more information on that. But with that, again, just our sincere thanks from the Chamber and all of our members who are on, and I'll turn it over. I believe Brock was going to start. Am I right there?
Actually, I'm going to give the floor to Ben. Let Ben start, and then yeah, that's kind of how we plan. So yeah, appreciate
All
it.
right, thank you.
No problem. Well, the first thing I'm going to do is I'm going to share my screen because I do have a presentation to offer. So I'm going to go ahead and try to get that queued up here. Be patient with me because I'm a little new at this. Okay, can everybody see that? Everybody
Yep.
can see that?
Yes.
Okay. Okay. All right. My name is Ben Weaver. I'm the owner and operator at Servpro of Ebensburg in Indiana County. I think I know a lot of you. I may have met you along the way at Chamber events, but I wanted to be part of this forum today that the Chamber had so nicely put on for all of you fellow business owners to help you guys, have a forum to ask questions, to get help, to get whatever you might need resource-wise to get back, to reopening here. I know it's been very frustrating. Thankfully, our business was deemed essential. We've been out on the front lines helping to clean this, help to prevent the spread of this, doing, precautionary cleaning, also doing, full-scale decontamination for certain businesses. So I wanted to really be a part of this to offer up any knowledge, expertise that I could to you, answer any questions. I also have with me my production manager, Keith Bailey. He's sitting next to me. You can't see him, but he can come in and answer questions for everybody as well. He's also been literally on the front lines of this, helping manage this whole process. So, he's even more of an expert than I am at this point. So that's why I wanted to bring him in as well. I'm just going to just talk to you a little bit about the agenda here on how we can help you. If you don't already know this, we do disaster planning. I know it doesn't really completely tie in with COVID, but if you haven't taken advantage of our disaster planning services, please feel free to reach out to me at the end of this at some point in time. We can talk a little bit more about it, what exactly that means, but it's better to plan for disasters before they happen than after the fact. And this does kind of fall into that realm of, okay, how are we going to plan for these types of things moving forward? Because is this the last time we're going to see something like this? God forbid it ever happens again. It gets as bad as it was. They start shutting things down again, but this is a great time to look at your insurance to figure out, do I have loss of business coverage? Do I have enough protection in place? Do I have, the ability to set these things up where people can work from home? That's all part of disaster planning. It's something that we can help you with. The second thing we want to talk about is what we're calling, what has been called precautionary decontamination or precautionary cleaning. Something that, a lot of businesses are doing, whether they're having us do it, whether they're doing it themselves. But there is evidence that precautionary type cleaning going around can help prevent the spread of this emerging pathogen, emerging virus. Doing routine cleanings and what certain protocols, what certain things we need to add to what we're already doing. So we're going to talk about that. We're also going to talk about targeted routine cleanings. If you own a business and you've already been open or you haven't closed, what are some of the common areas, in your building where there's a lot more activity that, you may want to consider having somebody come in to do targeted routine cleans. We're already doing this for a number of different businesses, and we can talk about that. We can talk about pricing and what exactly that entails. Then we'll also talk about if you do have a confirmed or a suspected case, what full-scale decontamination looks like, what PPE protections are necessary, what certain chemicals we use, all of that stuff. So with that said, I'm going to play a short video for you guys, and then we'll move on to the presentation here. So hopefully this cues up and everybody can hear it, but I think it should work.
As we all come together in these times of uncertainty, many are being called on to do their part. At Servpro, that means reaching out to our communities to clean, disinfect, and sanitize our homes, businesses, and shared spaces. Our cleanup practices adhere to CDC guidelines, and our use of EPA-approved products means you can trust us to safely sanitize your home or business. Feel secure. Call Servpro.
Okay, so there's 3 different types of categories when we talk about categories of cleaning. We're used to this terminology in our field because we call different categories of water when we go and do water losses, category 1 being clean water and category 3 water being more sewage related. But when it refers to this type of cleanup, they've broken it into 3 separate categories. Category 1 is your preventative measure cleaning. There's been no identified virus of a person that has been tested on site. Nobody's contracted this. You don't have any evidence of that, but you want to provide some level of a professional cleaning to your property, to your building, for a number of reasons. The psychology of it, when your employees are coming back in, it's not the same janitor that's been cleaning. It's a professional outside third-party cleaning company that's coming in either routinely or, a once-over before the business reopens. That's what we would consider to be a preventative measure cleaning. Now, this can be done by your own staff, your own employees. Some businesses have chosen to do that. When you're doing preventative type cleaning, you're doing it throughout the course of the year. It's why we clean. When this virus emerged, that's when they started to, call us and have us come in to do this type of related cleaning. We don't normally do a ton of routine cleanings for businesses throughout the year, aside from carpet cleaning and duct cleaning, but this type of category is something that you can either choose to do it yourself or you can have another professional company in. And we'll talk about the pros and cons to both of those later on here. Second category, we consider category 2. This would be anybody that there was a reasonable suspicion of virus present. 1 or more people that have been on site are currently being tested. I know that the testing has been an issue since the get-go. Initially, it took, I think, about a week to get results back. Then it was down to like 48 hours. And I think there's some tests available now that they're getting results back on the same day. So in the meantime, we've had businesses where they have called and said, we think we had a case. We want you to come in, do the full-scale cleaning. And really, in that case, we have to treat that like it's a category 3 cleaning, because at that point, we don't know what we're getting into. We don't know what the potential is. If there is a potential there, then we have to treat it as if it is an actual confirmed case. So category 2 and category 3 are really one of the same, but we do break out that third category when we have a proven viral threat on site. 1 or more people have been infected, they have been tested, they had COVID-19, and they were in the building. We did a very large cleaning job at an office complex for Verizon, not in this area, but they had a guy in there that was doing remote setups for all their computers, and he tested positive. He went around and touched everybody's surfaces, and they basically had to clean the entire building because it can live on surfaces, they're saying, for up to 14 days. So it does, category 3 type cleaning is full scale, full PPE. And there's been some statements that have been put out there, and this is just one of them. This I'll just read. A virus capable of killing 2 to 5% of people that it infects is considered a biological threat capable of being immediately dangerous to life or health. Effects from exposure to contaminants may be immediate or have delayed and permanent adverse effects. Therefore, workers should be properly trained and protected with the appropriate PPE. PPE stands for personal protective equipment. And they should have some level of training, whether that be from OSHA or HAZWOPER or some IICRC-based training. But when dealing with cleaning up this virus, when you know that you have had it, in some cases you just don't know. You know, we were talking before off mic, and we were talking about certain grocery stores, and how do you know going in there that you're not coming into contact? It's almost impossible, because it's really impossible to be able to wipe every single thing down. Because I know I've done it. I've gone to the grocery store and picked something off the shelf and said, "Oh, I don't need that." I put it back. Well, if I was infected, I would have just touched that, and it could have transmitted that to somebody else. So, you know, we live in a different world now, and we have to start thinking around these types of things. So, as far as cleanup scope, work, and planning, the CDC encourages cleaning of all the high touch points, and that includes your countertop, your counters, your tabletops, your doorknobs, your bathroom fixtures, your toilets, your phones, your light switches, you know, coming in and out of a room. And then also, when we go in to do the cleaning, we clean out beyond those touch points, not just the touch point, because what's happening is people aren't grabbing that doorknob. They're grabbing the top of the door or the side or the bottom, and they're trying to avoid that touch point because they know everybody else is touching that. And I find myself doing it every time I walk in the sheets. You know, you grab the door and you try to bump it open with your arm or something. So we know where people are normally coming into contact with. So it's those high touch point areas. And at a minimum, 10 to 12 inches out beyond that is really where we're focusing our cleaning when we're doing the preventative type cleaning. Why do you do preventative cleaning? And this is really important. Cleaning removes the soil and dirt that harbors the infectious agents. So you're not only just cleaning and disinfecting for the virus, you're actually cleaning the surface areas need to be cleaned. You can't come in and just disinfect a building without wiping and cleaning certain debris and dust that the virus can embed itself in and can sit on top of. So cleaning is really the first necessary step in disinfecting a surface. Both cleaning and disinfecting must be part of your plan. We're going to talk a little bit about this, and I'm sure we're going to get a lot of questions about this. So I want to keep this brief to leave as much time as possible for questions. But the question is, why would you use a restoration company or a professional cleaning company to do your preventative cleaning instead of your employees? Well, for a lot of business owners, I'm guessing, a lot of them are looking at the numbers and saying, well, I can have my own people do this, save money that way. You really have to think about what your actual costs are by the time you buy the right product, by the time you pay your people, by the time you protect them. And then not only that, but the liability that you might be assuming, by having your own people do it. So, you may reduce your operational hours so that employees can restock and do preventative measure cleaning on your facility. You're using your labor force, providing a safe environment for your patrons, employees and families. At least that's what most people are thinking. It might not be the case because, again, talking about this specific virus, it is the fastest spreading virus in modern era that we know of, and it's resistant to certain chemicals. So, and you have to clean very thoroughly, like I said before, in order to fully mitigate it if it is in your building. The other point that we want to make here is that your employees, for the most part, and I don't know what businesses I'm all talking to here and what level of training people have. People might have a cross of training. I'm not privy to all that, but I'm just making assumptions that most employees are not trained in infectious disease control protocol. Most lack proper training in chemical application and cleaning, and they don't have the appropriate personally fitted protective gear to protect them from contracting this virus when they're working. This is just some photos of some of the PPE that we currently have that we use when we're doing full-scale cleaning for COVID-19. Full face respirators, full Tyvek suits, top to bottom, gloves on, taped around the seams. And there's a certain procedure, most people don't know this, but when you put on PPE, there's a certain procedure to put it on called donning and don off procedures. So when you put it on, it has to go on a certain way. And then when you take it off, it has to come off in a certain sequence. Otherwise, you can contaminate yourself simply by just taking it off wrong. And I have all this information. If anybody wants more specific type information, we have a whole litany of resources available to you. If you don't know Servpro, Servpro is one of the largest companies that does restoration work. And they have worked day and night to help supplement us with resources, their franchise community, so that we can pass it on to the rest of our community to help you guys, get through this. So we have a ton of resources, and please, reach out to me when this is over. At some point in time, I know it's Friday, everybody's probably ready to tie one on, but again, you just want to weigh that option, whether you want to put your company at liability, for an employee or a patron to get sick, which could put an additional financial strain on your business or the owner. We want to partner with your organization to assist you with our expertise so that you can focus on what matters. And especially right now, that's your business. Let your people focus on your business, because if you haven't been operational for the last 2 months, 2.5 months, you're going to be playing catch up. You're going to be inundated with all kinds of stuff to try to work through the challenges that are facing you now. My professional opinion is to allow the professionals to do the cleaning, whether that's our company, whether that's all the other companies that are out there. There's many of them. We're not the only one. And if you already have a cleaning company that's coming in and doing routine cleanings for you, kudos to you, hats off to you. I would just suggest, if you haven't already requested it, request their SDS sheets, request the cleaning protocol, make sure that they're doing all of the stuff based upon CDC's recommendations. When we do a cleaning, this is something we leave behind. We let people know this was cleaned by us. Again, when you're bringing employees back into a building they haven't been into for a long time, and they're already in this fear mindset with this whole COVID thing, these are some of the things that, might put their mind at ease. Just knowing that this place was cleaned professionally by a professional cleaning company, whether that's, again, Servpro or somebody else. If you look on the right side of the screen, you'll see all of the products that we use that are compliant and listed on the EPA's website. Servpro oxide, Benefact Decon 30, a concrobium disinfectant, and then something called Vanquish. Again, these are things that we have in stock, and they're very difficult to get. And that's the other part of this, is even if you decided I want to do this myself, are you even able to get the chemicals, the products that that you need? And I know there's been shortages even on our end with a lot of this stuff. This is just a real quick picture. I'm not going to spend really any time on this at all, but this is just what we provide to you in that emergency readiness profile for disaster planning. It's a very concise document, contains all the critical information of your business in the event that you have some sort of a man-made, natural sort of disaster that happens to you. So we're very passionate about this. I speak about this all the time, and I'd love an opportunity to meet with any business one-on-one to tell you, just to help you with your planning for disasters. And then these are just some sources as far as where we get this information from. And I can present this, I can get this copy of this presentation to Amy so that she can provide this to anybody that would like a copy of it. But that's pretty much all I had. I'd like to just open this up to the questions or comments. Anybody that has anything. If we want to wait till the end, I don't know the format of this, but Amy, you can decide on how you want to do that. But Keith and I are here to answer any production related questions, specific questions for anybody that has any. Thank you.
Okay, thanks, Ben. I guess we'll just let people use the chat to go ahead and put questions in there. We'll go ahead and move to Brock as long as Ben's able to stay. Does somebody have a question now? Okay, well, let's go ahead and move to Brock then. And if you have a question, you can use the chat system to put your question in. We'll go ahead and go to Brock now, and then we'll answer questions at the end. Thanks, Ben.
You're welcome.
Okay, hopefully everyone can see my screen. Am I good? All right, excellent. Thank you. Thank you all for joining us today. Certainly, what you've heard from Ben is so critical right now. It's a critical time. It's exciting time right now, as we just learned a little exciting news. Not exactly where we want to be today, but at least it's a step in the right direction. So really, thanks to the Chamber. We really appreciate you guys giving us this opportunity to get out to as many businesses as we can to really help, to restart and be smart about it. So thank you so much for that. And what I want to do is talk a little bit about the emotion side that's attached to this. As we know, it's not like we're coming off a vacation today and going back to work. It's been, 6, 8, 12 weeks for some people that haven't been able to work. And, there's a lot of emotions that goes into it. So we want to talk a little bit about that, really talk about the preparedness as far as the work. And I'll move to the next slide. It kind of gives us an agenda. So talk about how are people reacting today? What is the new normal? You're going to hear that forever. It's probably just a new buzzword now. What does ready look like? And how is the work environment connected to employees' emotions? I think it's really important. Their emotions of well-being is something that we really connect with and that we're aware of. But first, I have to give you an official disclaimer because I'm not an attorney, nor can I provide you with any of that legal information. So this presentation you are about to witness should not be relied upon, construed as legal, financial, and/or medical advice. The law is changing literally every single day and can vary from state to state and even city to city. Please consult your own legal, HR, and finance resources and consider state and local law variations before making any policy or procedure changes. Now that that's out of the way, we can talk about how people are feeling about work today. You think about this, the emotional needs are at the surface. As regions start to relax their quarantine mandates, which we're going to find out today here in a couple of minutes, I hope. And I think, Amy, you let the cat out of the bag. I think it might be official, but I think we'll hear that whenever the governor comes on TV, I think at 2 today. The people will gradually begin to go back to work, working in their offices or shops or factories, warehouses, etc. Just a few months and even weeks, it's happening where people are going to get back out there. Best practices and etiquette have changed. These lifestyle changes not only apply to our personal lives, but to the workplace as well. Returning to work after COVID-19 may be scary, awkward, and jarring to both employer and employee. That's what we're going to talk about today. To ease this transition, companies will need to make changes to policies, the physical workplace, and their approach to the employee relations. In order for your employees to be prepared, the employer must first be prepared. Again, Ben talked about preparedness as far as the cleaning. It's so important. So are employers ready for the new normal? Manpower, as you know, we're a global company. Here we go, it's going a little faster here. Manpower is a global company. We've done an awful lot of surveys and we've been working on that. And what we found out is, obviously there's the essential worker. And I think we all feel that we're essential. I believe we are. Some people were allowed to go back work sooner. But now as we move forward, the economy knows that we are all essential in being able to do things. But when you think about when we started our work adventure, when we might have been newspaper delivery or work at a car wash, doing any type of delivery or even warehouse work, just stocking shelves, those were considered early on beginning menial jobs. Today, those are not the jobs. Those are essential people. You think about your grocery store workers and the people that are getting your food and products to you. Those are essential people and they demand to be seen as that. Leadership is changing too. We all have to change. We can't stay the way we were. We can't say business as usual. We can't say just do the job that I paid you to do. People are emotional in the workplace. People need to know that we understand as leaders that we are doing everything that we can to reach out to them to make certain that they feel good when they come to work and they have confidence in us as employers that we can do that for them. So what is work ready? So I mentioned that survey that Manpower did. The thing that stuck out to me the most is 69% of the employers surveyed across the country have not completed their readiness program. They're not ready yet. So again, Ben, you got lots of work to do with these guys out here. So, you know, I think that you're going to get busier for sure. As a company, Manpower, we've got a lot of work to do too, and we've done a lot in preparation of that to help our clients and local businesses prepare. But some of the things that we heard from employers are, you know, until we know when the economy will reopen, we cannot start hiring again. Well, guess what? Word's starting to come out. So what are they going to do now? Waiting is going to put you behind the 8 ball. I laid off employees who want to continue on unemployment versus coming back to work. Now what? So here's anxiety. The employer thinks, okay, here we are as employers saying, we're going to start back to work. Knowing your employees are out there, many of them are often getting the regular unemployment and another $600 per week. How do we compete with that, right? So there's some anxiety that the employers have as well as the employees. You know, if they call me back, what do I do as an employee? Do I have to go back? Do I want to go back? Do I want to look to find another job somewhere else? That all causes emotion. The next balloon is we're worried about how a second wave of the virus will impact our workforce. Boy, that's a big one. None of us really know. You listen to one side of it and, you know, we're almost through this. The other side says, hey, we're going to get it back come fall. They just released the NFL schedule last night. I was excited for a moment, and then realized that might not ever be able to go see a game again, at least this year. So all of those things as workers and employers come to mind. Employees are afraid to come back. So safety best practices are my #1 need in order to recover. Honestly, every employer needs to be thinking that right now. You've got to be thinking about the safety of your employees, whether it's paramount to you or not as far as productivity, whether you've got, you know, 2 or 200 employees, it should be paramount in your mind to be prepared, whether it's for legal reasons or for humanitarian reasons. Last one, my company has not completed a recovery plan or in some cases started one yet. If this is you, the red bubble, you need to get busy. If you want to get back to work, you've got to get on top of it. You got to start planning. And then as we progress through my presentation today, I'll give you a little bit to go with and some tips and pointers to move on. So here's my little Manpower pitch. You know, Manpower really is working hard. Many of you who are on here are clients of mine or have worked with me in one way or the other. And you know that our real goal is to work for the businesses and to help them be productive and be profitable and have fantastic employees along the way. So Manpower moved quickly because people are our product and businesses need us. We moved quickly to develop some guidelines, not only for ourselves in our offices, but also to give to businesses that we work with to give them an idea of what's best practices or some of the things they can do. So we created communication, which you're going to hear a lot about as I speak. Some training, which is additional communication, but helps people understand what they need to do, what's expected of them. And also as far as cleaning and hygiene and things like that. And of course, regular health checks. It's going to become a thing of the future, and it's going to be the new normal, guys. You're going to be getting temperature checks when you go into your office. You're going to be having to fill out a survey when you visit another business or, you know, the doctor before you can get in the door. You know, you're going to get a questionnaire. Things like that you're going to have to answer before you could just go about your business. So be prepared for that, and we can of course help you be work ready with that. But those 3 components are things that you should be thinking about and creating today so that you are work ready. So some more things: assessing your work site, right? Ben talked about that. Take a look at your work site. There's 9 different factors. Is a health screening plan in place? If not, it's going to have to be in order, especially when we move to green, guys. They're going to say, here's the things you need to have in place. We don't even exactly know what they will be, but you've got to be ahead of that curve. Second one, can social distancing be maintained at all times? Some places aren't conducive. We saw the meat cutting plants, right? So what did they do? They had to put the plastic or the acrylic in between, make some other adjustments. But you need to know this in advance. Can you function as a business and maintain social distance? If not, you're going to need to have a plan to adjust for that. Have we identified what personal protective equipment is required? Right? If you don't know, find out. Again, the CDC website's a perfect place to find that out. Also, OSHA.gov will help you out too. Do we have ample supply of needed PPE? That's another one. I understand some places there's plenty, other places there's not. You want to get your hands on it now while you can before somebody else does. So be prepared. So know what you need and purchase it in advance. Again, this isn't going away anytime soon. When we first were going into this, masks were a big deal. Can we get enough? How many? How much should we buy? And that expense was something that I considered, that I figured if we buy a little too many now, we should still be okay. We're probably still going to need those, especially if what we're hearing come fall is another run at this. Not to mention any other virus that comes through, or infection, or epidemic, even not even a pandemic, but an epidemic. These may become new rules. So prepare for that. Do we have a cleaning plan in place? Who's going to do it? Is it Servpro? Are your own employees going to do it? You're going to find somebody else to do it? How are you going to do it? And are your employees prepared to do that? Are we limiting the sharing of tools and equipment? If you can't limit them, you're going to have a place or a plan in place to clean them after each person touches them. I don't know if you heard about the NBA is looking at coming back and starting practices. Did you hear what they have to do? Every time a new player steps on the court, they have to sanitize the ball. Imagine the new game, right? You want to substitute. The new game, guys, is what we're doing today. So again, anytime you have an employee touches a new tool, that's just a new player walking onto the court. We've got to make sure that we're watching out for them and taking care of their tools and the equipment that they're touching. If you're in an office environment, it could be the stapler, or think about the copy machine or the coffee machine. Who all touches that throughout the day? Are we all cleaning it after we used it? Is it cleaned in advance? You got to think about that. How often are tools and equipment cleaned and disinfected, as I said? What controls do we have in place to prevent the spread of COVID-19? And have we had any diagnosed cases of COVID-19? If that's the case, then you've got to put extra practices in place, as Dan said. So, or Ben said, you need that. So there's your 9 pieces to assess your work site. And again, I can present this to Deborah and Amy so that we can get that out to you. Risk levels. Again, Ben mentioned the risk levels that they use here at Manpower, and we suggest you consider this as well. The risk levels are based upon the types of work that you do. Low risk or roles in minimum exposure to public, or social distancing is easily accomplished, office and clerical and call centers. Those kind of places, you can get away with just a general cleaning, social distancing, things like that. When you move into the medium risk, you got to be a little more careful. The roles that involve significant sharing of tools and equipment, touching of common surfaces, manufacturing, warehouse distribution. The vast majority of the businesses who we talk to are here in a medium risk. So it's a higher level and some requirements. And again, if there's confirmed cases of COVID-19, even if you're at low risk and you've had a confirmed case, you're going to be moved into the medium or high risk and have to take extra precautions. And of course, our food service and laundry service people, maintenance roles, hospitals, rehab facilities, healthcare, those are all high risk, as we know. And we've got to take care of those people and those work environments. Facility planning. Here's your critical recovery plan components. Ben mentioned this stuff too. Facility planning. Take a look at your facility. Be moving. Get that plan in place now. Look at what you've got. If you have to have someone go through and investigate your work site, draw maps, right? Things like that. We've had companies ask us to do cleaning and sanitizing for them. They literally have maps of the locations of the touch points so that our people make sure that they're cleaning those on a regular basis. As Ben mentioned, handrails, doorknobs, light switches, things like that. You're going to want to map those things out so you're prepared to make sure that nothing gets missed. It's important that we're cleaning, but again, remember the why behind it. We don't want anyone to get sick. And again, the backside of it, even if that's not the most important part to you, your business will shutter if you don't. So again, both sides of that, the business side and the health side is important. Doing health checks and monitoring. Learn what's important, what you've got to do, the temperature checks, how to monitor that, what you have to do, how often, and to whom. Communication and case management. Again, communication is key, and we're going to talk a little more about why that's so important. But manage those cases. What happens whenever you've got a critical issue? Case management can mean someone voiced a concern because Susie's not being as careful as she should be, or Joe didn't clean where he said he was going to clean. You've got to be able to manage that. And how does that happen in that open door policy? Where do they go? And what do you do when they bring that to you? Sanitization and hygiene, of course, that's of absolute importance, and you need to understand what it means. And procuring the PPE and equipment. Do you have a vendor already identified? Do you know where you're going to get your PPE? Do you have a backup? Because it's all very important to you. So the 3 key things employers should keep in mind: ensuring you have systems and processes and equipment you need to keep people safe. Number 2, very important, providing people with the confidence in putting their health first. Think about that. If you're an employee sitting at home and you hear the governor talking here at 2 o'clock and says, we're going to yellow, that means the people that need to go back into work and can't telecommute are able to go back to work. Their first thing is probably excitement. We hope that they get to go back to work. But their next thing is, am I going to be safe? Oh my goodness, what do I do? Is my employer going to be watching out for me? So it's so important that you can provide your employees with the confidence that you are taking care of them and watching out for them. And number 3, remember today more than ever, family commitments are front and center to people. We've got to be, as employers, understanding and prepared to put that first and put our people first, because this is front and center with them, and we can't afford to fall off of that. And we got to be on top of it and understand how important that is, and really the things that are going through people's minds psychologically, the fears, the concerns, the excitement, the wonder, all of those different things are going to cause some emotion before they come to work and when they arrive at the workplace. So this last slide is one that I prepared that, again, when you receive it, it's a little small to read. There's a lot of some ideas for you to be able to take a look at that can get you thinking. Making your work site safe, of course, is very important, and Ben spent a lot of time talking about that. Signage, making sure that your visitors are aware of what they have to go through to be able to get into your facility so that they're prepared in advance. You might even want to communicate that to everyone in advance, and I know a lot of businesses are doing that. Check your supplies, make sure you're prepared that way. Policies, I can't say enough around that. Most businesses have policies in place already, but take a look at them, because you're going to find quickly that your policies don't touch many of the things we're going to be dealing with starting next week when people go back to work. Review your procedures that require people to meet in groups and close quarters. Do you have big meetings every month, every week, right? Of more than 10 people? Can they maintain social distancing? If not, think about how you want to do things differently. Here we are on Zoom meeting, right? That's going to be a lot more of that happening, I'm sure. Review your sick leave policies. Guys, many of these are antiquated and they're not going to work today. Consider including mental health days. Some businesses are doing that already. You might just build that right into your regular PTO, but consider, instead of actually having to be sick and getting a doctor's excuse, or I'm throwing up, to call and just say, look, Mr. Boss or Ms. Boss, I need a mental health day. I'm stressed out, having a bad day. Granted, we don't have to extend this indefinitely or give them many, many days, but consider that as something that you might want to include into your sick days and vacation policies. Educate your managers to watch for signs of stress and know how to report it. You want your people to know how to report it and come to you and say, hey, I'm having some challenges. You want your managers and supervisors to watch for this closely so that they're prepared in advance, for 2 reasons. One, you care about your people, right? And the second is you want to make sure that the work environment is as safe and secure as possible for the rest of your workers. It only takes one person to feel discomfort in order for the others to start to feel the same way. Educate those managers. Create an EAP program. If you don't have one, you might want to think about getting one. Many of your healthcare providers do have a nice program, including mental health counseling, that you'll be able to use oftentimes for free. So I take a look at that if you haven't already. Implement your health checks and monitoring, and create that visitor policy. Communicate. It's in the middle, but it's in the front, middle, and back. Communicate with your employees early and often. Guys, if you're looking at people going to back to work next week, you should be communicating with them today. I can envision an email or a mass phone call or getting everybody out together and saying, guess you heard the news. We're going back to work. Let me tell you what you can expect. And here's what we're doing as an employer to prepare for you to come back to work. Let them know the changes have been made, including their workstations. If you change their workstations, your policies, anything like that, what they can expect as far as PPE. Will they need to wear masks? Of course. Will they be allowed to wear their own? Do they have to wear ones that you provide? Do they have to provide their own? All of those things are going through an employee's minds. Imagine the stress that this could cause. And how many people may not show up the first day to return from work just because of the psychological impact of COVID-19 to them, from being home to having to go to work now. Provide them with visuals if possible. So imagine going into your office. If you move your workstations around, do a quick video and send it out to your staff so that they know what's going on. If their tools have been moved, if there's new workstations or any dividers, let them know so they can see what it looks like. Encourage positive interaction among your workers prior to returning. Really, I mean, think about it. They've been away for 6 weeks, several weeks. You start to fall apart from each other. You don't have that same relationships. How can we get people back together? It's also an opportunity for, if you had maybe some stressed work relationships, you can start to rebuild those and get people even closer, because let's face it, everybody says, in times of need is when people pull together. This could be a perfect opportunity for you to not only bring people back, but also to improve the morale of your employees coming back into the workplace. Restoring productivity. Let me check my time real quick. All right, I'm doing okay. Will there be limitations in productivity due to PPE? Well, if that's the case, and it could very well be the case, if an employee is doing work and they have to wear gloves now, that could slow them down significantly. Figure out that workflow, the distancing. And if you think that's going to slow your employees down, just telling them to work faster isn't going to help. You're going to have to prepare for that, prepare new productivity metrics, maybe even consider hiring more people if you have to, whatever it takes. You also might need to communicate with your clients, prepare them for their needs. They might say, I need this. They might be used to getting something in a day. And now it's going to take you a day and a half or 2 days to prepare their product for them. Let them know that in advance. Due to COVID-19, it gives you a perfect opportunity to share with your clients. Consider adjusting your shifts, your times, the numbers based on safety and production requirements. Last but not least, guys, be flexible with the work hours. The first few weeks, it's going to be tough. It's even hard for me to say, hey, I understand you're stressed, but I still need 8 hours of work from you, or 12 hours of work, right? But we've got to be flexible as employers. Remember that slide, the new leaders? We've got to be the new leaders, because this is a new time. Provide your employees with a list of productivity resources to get them back to their routine. Give them the resources that they need. Give them, if they have new KPIs, get them to them. Tell them, here's where you got to do, what you have to do, where we need our productivity numbers. Allow them to provide you with the input as well. If their job allows it, let the employees work remotely a little bit longer. If they can work remotely, obviously, as the governor is going to recommend, they should probably be working remotely anyways. But again, if you want to stagger shifts or leave some people work from home and some come in and then flip them, it's something you might want to consider. Offer to add a few remote work days to each week. So in other words, employee might work 3 days in your office or on your in your factory. They might work 2 days from home, something like that. Really important to embrace the open door policy. That's probably the most important thing I could bring to you. Provide your employees with a safe place to discuss their concerns, their problems, their anxieties. Make sure their supervisors are aware and open to this, and that they can provide that in a safe environment, and that when they share that information, what the protocol is and how you as an employer are going to respond. These are some significant things. I know it's a lot of detail, but again, as I said, I could provide that to you in that slide deck. But certainly be thinking about these. I'll leave you with this, though. Richard Branson once said, if you take care of your employees will take care of your customers. Remember this, now more than ever. This is a profound statement, and it's imperative if you're going to be successful as a business, as an employer, and really as a human being today. All right, guys. Thank you. I appreciate that. Here's my information on here. If you need to reach out to me, my email's on there, my phone number, my cell phone's on all the time. Anybody that's ever had to call me knows that. So I will always answer. And with that, I'll turn that back over.
Okay, great, Brock. I really love the idea of either a video or some sort of communication telling employees what to expect when they come back. That's really simple, but really could have a big impact. I like that a lot. We will open it up to questions. I actually will go ahead and kick it off. I had one for Ben. So you talked about maybe bringing somebody in to do that deep clean, but the daily cleaning, I'm still hearing, and I know it's still hard to get some of the products like wipes and that kind of thing, you know, that we're going to have to be doing in between maybe big cleanings. So any information on that, like where to find things or how to make them yourself, or?
What do you think on that?
Well, I mean, hello. Essentially, the New England Journal of Medicine, when they release their study that everyone goes back to quote and reference as far as how long the virus lives on certain surfaces, needs to know that that study was done on those surfaces that were clean surfaces. No residue, anything of that nature. So essentially just regular cleaning. If you have housekeeping services or an individual that's identified in cleaning the property, obviously their hours are going to increase, but they can just do what they normally do in a more frequent manner to get the oils from your face and hands, the dust from, you know, getting the dust bunnies, getting the cleaning done. Then you're obviously going to be within the confines of that study that was published in the New England Journal of Medicine. So if you're in a facility that's not cleaned as often or cleaned less frequently, then we are tasked with doing the cleaning first and then the disinfection, which obviously rises the cost. If we come in and the place is cleaned up, then those chemicals, regardless on the CDC list N for appropriate kill claims that are applicable to COVID-19, then those will work on those surfaces. So it's not like you have to go out and arm wrestle grandma for the last can of Lysol at Home Depot or anything like that. It's just doing your job and everyone taking care of making sure they're washing their hands. You know, happy birthday twice. There's other songs less appropriate, but just making sure you're washing your thumbs, the backs of your hands, your fingers all the way around every time that you have the chance, not just every 20 minutes or whatever. And making sure that, you know, antibacterial hand soap on a dish rag, the dwell time, as it's known in the industry, for something like that is pretty much just applying it to the doorknobs and letting it dry there. And then the next time around, the same thing. You don't have to use that chemical that's needed for every cleaning as long as the surface is clean and everybody that's in the facility is doing their part to contribute to a safe and germ-free environment as best you can.
Looks like we have another question here. For buildings, this is from Deborah. For buildings with public restrooms, do you recommend closing those? If not, how often do you recommend everything is sanitized? There can be hard to monitor. That can be hard to monitor.
Yeah, so, I mean, public restrooms are public restrooms. You can go into one gas station, turn around and walk out, and you go into another one and you're like, wow, this is nicer than mine. So it's really everybody's, it's every business or building owner's responsibility to do their due diligence. And again, it's the chemicals that you use. We have 3 products under the Servpro umbrella that can be applied through an ultra low volume mister that as long as you go in and essentially what's called fogging or fog the airspace, the chemical allows that dwell time to kill any bacteria or virus that's on those surfaces. And it's, you know, as simple as walking in and fogging the area and then giving it an appropriate amount of time, 10, 15 minutes. So I would say that if you have that person, as it's outlined by Pennsylvania Department of Health, that you should task with cleaning the store, I would give them a little more responsibility and say, you know, you go past the men's room and the door's locked, hang around, wait for the guy to leave, and then go in and just clean the touch points. Obviously, if it's a handy capable individual, you're going to want to touch all those assist bars on and around the facilities to make sure that it's clean as well and sanitized. Let's see, from Amy, on the level of risk, where would you put retail stores? Well, right now, I mean, as far as what Servpro is concerned, retail stores in this area have pretty much been closed, even with stocking. I live closer to Altoona, and I know Logan Town Center is a ghost town, except for takeout at Texas Roadhouse. And there's been nobody in there. Even if the last person out of one of those retail stores was a confirmed case, the place has been closed now long enough that the virus wouldn't have survived. So initial open up, I would say that it's good to go as long as they're following the Department of Health's guidelines by having that 1 or 2 or 3 people walking around with a rag and a spray bottle with disinfectant, making sure that they're getting the identified touch points.
If I can, this is Brock. As far as the risk levels that we've assigned to 1, 2, and 3, retail can fall, in my opinion, not as a 1, just simply because of the number of people that are coming in and touching. And as I think, Ben, you mentioned, you know, decide they don't want that and put it back. So
Right.
Retail is at risk, and there's a high volume of people coming through touching. It's a high touched area. So that would be between a medium and high risk, I would state. So it's one that and that's why retail's been kept closed for quite some time, for the most part. Any other questions, guys?
I have one more. So thinking about retail, and if you're going into, say, TJ Maxx, that'd be so fun. Are gloves a good idea? I've heard pros and cons, like if you wear gloves, but then you touch your face, it's really no different. Like, so do you recommend gloves or not?
I mean, that's gloves protects your derm from whatever you touch. As soon as you touch a contaminated surface, everything those gloves touch is a contaminated surface. The key is washing your hands. It really is washing your hands. And again, if I had a penny for every time I saw a discarded set of rubber gloves along the road or in the parking lot or on top of the garbage can as opposed to in it, I wouldn't be working. So it really doesn't help, especially if, you know, in this day and age, as soon as the cell phone makes any kind of noise, somebody's pulling it out of their purse, out of their pocket, whatever. If you have rubber gloves on and check your phone, put it back in your pocket, game over. The gloves were worthless.
Okay. Kind of what I thought. All right. Well, looks like that's all of our questions. Again, thank you guys so much. I think the timing of this is awesome, and it really gives us a lot to think about. And I appreciate you letting us share your slides with everyone who's on
Maybe
here.
we do have one more question
Oh,
from
I'm
Sharon.
sorry. Oh, there we go.
Yeah, Sharon, I can help you with that too. Is really what the CDC guidelines are going to be, and just to read it for everybody. Sharon asked, you know, what would protocol be for doing a fitting like a bridal gown? You know, social distancing. How are you going to do it? That will be very difficult. So, you know, you may need to do something. Try to adjust how you do it. Maybe you have the bride, you know, make recommendations or adjustments. I do know that there's new apps that are coming out that determine people's size based upon measurements from a picture on an app. So this may be something that the bridal companies end up moving toward. I bought a shirt that way and it actually kind of works. So there's more things that are going to come down the pike. I would look into that if I were you, Sharon, because it would be the safest way to do that. But there is technology that's coming to you that could help you.
Okay. All right. Well, thank you. I don't think I see any more questions. So good question, Sharon. I do want to thank our sponsors today, Wessel & Company and also Servpro. So thank you for that. Just again, a reminder that the Chamber is going to have a reopening packet for members. So, and that will have posters in it, things like please wear a mask or social distancing guidelines and that kind of thing. So we'll get that to you guys. And again, just big thanks to Ben at Servpro and Brock at Manpower. And we really, really appreciate this. Thank you so much.
Thank you all. Good
Anytime.
luck
You're
to you. We
welcome.
appreciate it. We're here for you if you need us.
All right.
And
thank
I did not get to put my information up at the end of that slide, so if I could just do that real quick, and
Sure.
everybody would have my information as well if they need it. So I'll do that real quick and then I'll sign off. So.
Okay. All right. Good deal.
There you
Thank you,
go.
Ben.
All right,
Okay,
guys. Stay well, everyone. Thank you.
okay, thank
Take
you.
care. Good luck to you all.
You too.
Thank you.